Okay, so good. Welcome again, Lab 3. We've got a patient here who is an inpatient we decided to do. We actually had a few cases lined up that I thought would be interesting with little twists. We had a possible clip in ring, and then we had a failed Alfieri, but neither of them could show up for today's case. Unfortunately, this patient is here and really can't get out of the hospital. So he's a 58, 59-year-old gentleman who has a remote CABG history and also has had a renal transplant and a pancreas transplant, and now has acute on chronic heart failure. His really quite a bit of heart failure. Was admitted a couple weeks ago, was treated for possible pneumonia, possible heart failure, that whole thing. Found to have an EF of 30-35% with severe MR that was not due to flail or degenerative leaflet tissue. He was diuresed and sent home. We saw him in the office in valve clinic, and he didn't look good, so we readmitted him. He couldn't sleep at night. He had a lot of orthopnea. He's been on the heart failure service now for 3, 4, 5 days, 4 days, say, with real aggressive medical therapy. Let's turn it over to Jyothy. Please, Jyothy, show us the valve and what you think is important in this case.
I'll show a few images that highlight the findings in this patient. So here's kind of a quick view of the long axis view that shows this infralateral wall motion abnormality and kind of the classic restricted posterior leaflet with a posteriorly directed jet of mitral regurgitation. I'll go on to some of the images that show the pathology here very well. That shows that the mitral regurgitation is severe. By a quick and dirty PISA, you see that the PISA radius is about 1.2 centimeters with an aliasing velocity of 40, suggesting that this is indeed severe MR. We've done some measurements of the posterior leaflet at the P2, P3 level where most of the restriction is, and you see that the leaflet's about 1.2 to 1.3 centimeters in length, and kind of Mark will come to the discussion about how this incorporates into decision making of the type of clip.